At ASCO, Trust One team reported efficacy on a larger patient sample that was previously reported in 2023. We saw that results at ASCO were pretty consistent with the previously reported data. For example, in TKI-naive patients, they enrolled 106 patients and showed overall response rate of 90.6%. It is important to know that median progression-free survival was still not reached in this cohort. And at 2 years, 70% of the patients were still without progression, which in my opinion is a very, very good outcome. In a second cohort, which was, as I mentioned, a TKI pretreated patient population, they enrolled 66 patients and saw overall response rate of 51.5%, and the median progression-free survival was 7.6 months. And very important, as I mentioned in the beginning of our discussion, because taletrectinib is a newer generation TKI, which we hope will have activity against the G2032R mutation, which is most common resistant mutation to other ROS TKIs. They actually reported overall response rates specifically for that cohort, meaning patients who developed 2032 resistance, and there the response rate was 66.7%. Also, very importantly, they specifically described a CNS efficacy of the drug, showing that in measurable CNS lesions, overall response rate was 87.5% in patients who were TKI naive and 73% in patients which were TKI pretreated. At this point, I think it's difficult to say. The potential two settings where taletrectinib could be used. It could be used in the first line where patients have not been exposed to TKI, but also there is efficacy in post-approved TKIs. So I think once we have a full analysis set, we'll make a decision, and I don't know if regulatory agencies will require a head-to-head clinical trial against currently approved standard of care or not. I think that remains to be seen.